Sciatic is one of the most common causes of disability from work, and patients often develop sciatica that drags on indefinitely. In cases like that, it is important to determine whether or not the sciatica is a typical sciatica originating in the spine or whether or not we're dealing with a different process. Let's take a closer look. Almost everyone is familiar with sciatica. They're in the garden lifting a box when suddenly they feel a blow in their back, like someone struck them with a hammer, and then they have to limp over to a bench. At other times, the pain comes out of nowhere, and for weeks, patients are unable to sit at work or stand in line at the checkout counter or even go to the gym. But whenever and however the pain starts, the explanation is always the same. The well-meaning doctor says you've thrown your back out. But is that really the case? Sciatica is pain and numbness running along the course of the sciatic nerve, from the lower back into the gluteal muscle, the buttock, and into the back of the leg. And 90% of the time, this is the result of some abnormality in the spinal column. Maybe a bulging disc, or maybe a herniated disc, or a ruptured disc, or spinal degeneration pinching on the nerve. But ever so often, sciatica is caused by structures outside of the spinal column. And when this is not diagnosed by doctors, patients are made to endure unnecessary diagnostic tests and needless expenses and a protracted course for their illness. Sciatica of the lumbar spine frequently resolves spontaneously or with medication or with physical therapy. But when the pain is the result of pinching of the nerve outside of the spinal column, it can be difficult to diagnose and can drag on indefinitely. As the sciatic nerve runs along its course, it comes into contact with multiple structures. After leaving the pelvis, the sciatic nerve enters the deep gluteal space, and any of the muscles, such as the gemellus or the obturator internus or the quadratus, any of these muscles that form the deep gluteal space can compress the sciatic nerve and produce symptoms indistinguishable from sciatica caused by the spinal column. Sciatic pain that originates from this area, the deep gluteal space, is known as the deep gluteal syndrome. It is not uncommon for patients to be diagnosed with spinal disease when their pain originates in the deep gluteal space. They may even end up having unnecessary spinal surgery as a result of this. One of the muscles that forms the deep gluteal space, the piriformis muscle, is a muscle under which the sciatic nerve passes directly and which frequently presses on the sciatic nerve, producing the so-called piriformis syndrome. Piriformis syndrome can be difficult to diagnose because there's no specific physical finding and no single diagnostic test to diagnose this condition. Doctors must therefore rely on the patient history as well as clinical signs. Fortunately, pain in the buttock, pain on sitting, pain in the notch where the sciatic nerve comes out of the pelvis posteriorly, and sciatic pain produced by stretching tension in the piriformis are frequently found signs that can help with the diagnosis of piriformis syndrome. But other injuries can also occur in the sciatic nerve. For example, patients can suffer sciatic pain by sitting on an overfilled wallet with a large number of credit cards. This is popularly known as walletitis or credit carditis. Patients may suffer sciatic pain from injections given into the buttock, into the gluteal muscle, and this can sometimes cause serious injuries leading to foot drop. Patients who practice yoga and sit in the lotus position for extended periods of time may develop sciatica because of the pinching of the sciatic nerve. This is a pain that has nothing to do with the spinal column. Young women may develop cyclical or catamenial sciatica as a result of cells from the womb implanting in the vicinity of the sciatic nerve, producing symptoms during their menstrual period once a month. But there are also more ominous causes for sciatic pain, such as tumors in the pelvis or tumors in the sheath of the nerve, or abscesses in the muscles over which the nerve runs. Because of this plethora of causes for sciatic pain, it is always advisable to have a careful and thorough diagnostic workup. If your sciatica is not responding to conventional treatment, maybe it's time to go back and have a second look. I hope you enjoyed this video. If you did, share the video with your friends and family. Thank you for watching. Subscribe to the channel to support the channel. Until the next video, stay healthy and stay safe.